Going to breastfeed, how often would you attempt to breastfeed the baby in the beginning?
When the baby's first born, it should be breastfed in the delivery room. If you could possibly get the baby to latch on your nipples immediately at birth, the baby nurses better from then on. That first nipple that he experiences is if it's his breast, if your breast rather than a bottle, he will be a better breastfeeder. Most babies are hungry right after they're born, and it's easy to put them onto the breast. As they get a little older in hours, to 1 hour, 2 hours, 10 hours of age, they tend to get sleepy and they don't nurse very well the first day. So we like to try to catch that first feeding as early as possible. After that, we try to nurse them every 2.5 to 3 hours, and it depends on how well the baby is sucking, whether or not that feeding is going to go a long time or a short time. Nowadays, rather than the old advice, we tell mothers to try to do a whole feeding on one breast, to let them nurse on one side until they're finished, burp them. If they want more, try to nurse again on that side to try to empty the breast. And then the next feeding, 2.5 to 3 hours later, we give them the other side. This is new advice. It just came around in the last 5 or 6 years. It's shown that the last milk that comes out of the breast, when it's almost empty, has the most cream in it. It's the richest milk, and the baby actually gains better from one side than he does from taking part of both sides. And we found that most mothers' breasts will accommodate to filling up alternately like that. However, in the very beginning, sometimes you have to nurse on both sides just to relieve the pressure, or sometimes you have to pump out one side if the baby's finished from the other side. So that brings me to a whole different issue, which is how to avoid the pain and difficulties of sore nipples and engorgement right after the baby's born. Babies nurse for the first couple days, and if the nipples are flexible and they can latch on, the mothers feel fine. But then two things happen. One is the nipple gets sore from the baby's sucking on it, and the other is the breast gets too full. The milk will the first milk that comes out is called colostrum, which is clear, and the breasts are not very full of it. And then suddenly, in a young mother, age 18, 19, 20, within 48 hours, it will change from colostrum to milk. As the woman gets older, especially as she gets into her late 30s and early to mid 40s, that transition can take a lot longer. So the younger the mother, the quicker they switch over to milk. But when it happens suddenly, the breasts become extremely full, and it's something called engorgement happens. When that happens, it's critical that the mother keep nursing and nursing and nursing and pumping her breasts and emptying her breast at the end of a feeding with a pump. And you can store the milk in the freezer if you want to, but not to let the breast stay too full. In the later weeks of nursing, the more you nurse, the more milk you get. But in the beginning, the engorgement is going to happen no matter how much you nurse, and if you don't empty those breasts, they just get more and more and more engorged. You produce enough milk for triplets the first few days. You just have more milk than you need. So pumping it out it's on overdrive. It's not going to make any difference. So you empty it, it'll soften the breast, the pain will go away, you'll feel much better. We also advise mothers to wrap their breasts in green cabbage leaves, because that also helps to relieve the pressure on the breast. That only lasts for a day or two, and when the engorgement's over, then she can settle down and just nurse the baby for what he's hungry for, finish that breast, and then go to the next breast on the next feeding. As far as how to avoid the soreness of the nipples, the most critical thing is the baby has to really be attached properly, with the whole areola in the baby's mouth, not just the top of it, that the nipple goes way back into the back of the baby's roof of his mouth. And if you're not sure, if your nipples are hurting, it's possible he's not latching on well. When that happens, you really need a lactation specialist to watch the baby suck and to see what's wrong. Sometimes you need nipple shells to help bring out the nipples. Sometimes you need a nipple shield to protect a sore nipple. But that's something you need expertise with. It's very hard to do this on your own without somebody who really knows what they're helping you with.